The emergency department is the gateway to the community. We are immigrants. We are first generation, we are second generation, we're essential workers, children of essential workers. That's the heart. We are the community we serve, and so I think that reflects in what we do.
Our charge is to bring the excellence of the Mount Sinai Health System into the communities we serve.
There's an area of emergency medicine, this focus on social medicine and really understanding your community.
What can we work with the community? How can we better engage the community and provide services for them?
What I've found is that when I involve the community early on, they help me to frame the question so that I get at the real problems and the real causes.
There's a lot of things that we do well locally in the emergency department, but there are things we could do better if we could bring services to where it's needed out there in the community.
What I have done routinely is been able to go to the community and ask the question, what are the health services that you think you need? Hepatitis C was one of those areas that needed attention. We spend a lot of time working with hepatologists to make sure that there's a seamless transition to care, a transition from the emergency department to their clinic.
We have an opioid use dependency or epidemic going on with opioids. Community members can come to the emergency department and at least get referral services to where they can get the care they deserve.
The way we care for people really has to be tailored to what the patients need. And we actually developed a project where we partnered with 7 senior centers to do a warm handoff of patients discharged from the emergency department to the senior center so they could get those services, they could get nutritious meals, they could have access to exercise groups and walking groups and social interaction. Those are things that we could do out of the emergency department to improve health.
We must take our encounters with our patients quite seriously and expand what we can provide them.
In this community, we have more working class individuals, some of whom have no insurance. It's so important that we provide the same level of care to the outer boroughs so that all of our communities have the same access to specialized care. Being part of a larger system can help to make sure that we provide all of those services to this community. That's part of making sure that we meet the standards of being equitable.
We have to recognize that we are the front line. We are the gateway to care for lots of people out there.
To utilize the location of the emergency department and to build an infrastructure that's seamless, that allows for the education of the community, that's truly an amazing thing.